Okay, just found out this afternoon that the nursing home that my dad is in is ending their Medicaid contracts. And he has until September 15th to figure out what to do. And so I've just been down the rabbit hole to try to figure out why would a nursing home end their Medicaid contracts.
So it's because of the big beautiful bill. I'm going to save you the trouble of going through a deep dive. That's why this is happening. Because I don't think people realize that 65% of nursing home residents are covered by Medicaid. So what did y'all think was going to happen when Congress just passed the big beautiful bill and Donald Trump signed it into law, which had nearly $1 trillion worth of Medicaid funding cuts in it? I mean, it's going to shift the burden of cost over to the states, and a lot of states are not going to be able to eat that cost without jacking up taxes or cutting other benefits, so they're going to cut Medicaid funding.
Okay, so this morning I get up and I'm seeing all of these people down my timeline talking about the fact that in the next 20 to 30 days, they have to come get their parents out of the nursing home because the nursing homes no longer accept the Medicaid and Medicare or whatever, right? It brought me back to in my early 20s when I was working at a nursing home. I was activity director. And I remember that majority of the people that lived at the nursing home were older white people. Majority from up north, but you get what I'm saying. Older white people. The thing that gets me is the fact that people voted for this to go away, right? You voted for it. I don't know if you voted for it thinking that there were going to be some exceptions, but you voted for this. And to see so many, and I'm sorry, but that's what I'm seeing, so many white people on here complain about the fact that they have jobs, they have families, they can't take care of their parents.
So, trending on social media right now, there is a woman asking why her father is being kicked out of his nursing home by September, and he's on Medicaid. So let's talk about why this is happening. Across the country, nursing homes are cutting ties with Medicaid residents. Not because they want to, but because they can't afford to keep them. Medicaid pays some of the lowest reimbursement rates in the entire healthcare system. And in many states, those rates haven't kept up with inflation, staffing costs, or increased medical complexity. So nursing homes are losing money on every Medicaid patient that they currently care for. This crisis didn't start overnight. Under the Trump administration, federal policy pushed for Medicaid cuts, block grants, and privatization.
My dad lives in a nursing home, and by now I'm sure you've seen the video circulating about the woman who's really concerned because her dad is getting kicked out of his nursing home due to Medicare. And this is just the anticipatory changes that the big beautiful bill is putting into place. What people don't understand is a lot of nursing homes are actually owned by these big corporations, right? So the big corporations, your local branch isn't that, but like they are owned like by private equity, things like that. Like I know the one that my dad lives in is like that. And so the rules kind of come from on top. So it sounds like some of these nursing homes are figuring, well, we're not going to get reimbursed from Medicare in the future. So we're going to just start evicting people who, you know, pay that way because we don't want to suffer the losses. And instead we'll try to fill those spots with people who pay out of pocket.
I seen some posts about them saying that people gonna basically be getting kicked out the nursing homes because they rejecting Medicaid and Medicare and stuff. And a lot of older people are gonna pass away. Some of them gonna pass away in the streets and never gonna make it to a family member's house or to some type of care or housing. I worked in a nursing home, and when like people came there for rehab or something like that, if they didn't have nowhere to go after that, they literally would roll them outside to the end of the street with their damn bags. And if they had something wrong with them that was like medical that they probably could need help with, the nursing home sometimes would call the ambulance for them. And if the ambulance didn't take them, they was shit out of luck. Then there's people that went home with folks that you could tell they did not want them to go home with. They was being rough, getting them in the car, throwing their bags in the back. You could tell that they was going to roughhouse them or lead them in a room to basically urinate and poop on themselves all damn day.
If you haven't seen it in the news by now, it is estimated that 12 million people will be losing their Medicaid coverage. And I say coverage just because I feel like there are a lot of misconceptions and myths around what Medicaid really is. So I have a background in public health. I've worked in the Medicaid space, and I'm currently working in the health system. So I feel pretty qualified to talk about what is going on and the long-term impacts of what everyone will experience, whether you're an insured or non-insured person.
Hi guys, welcome to the channel. Thank you so much for your support and thank you so much for clicking on this video. Across the United States, something seriously troubling is happening. Nursing homes, places meant to provide care, safety and dignity for the seniors, are adding their Medicaid contracts. And while that might sound like a minor policy change, it's a crisis that could leave thousands of elderly and disabled Americans with nowhere to go. Let's get to the video, but before, let me play a few clips on the same and I'll be back with my commentary. All credit goes to the original creators of each and every video you see here.
And nursing homes have to respond to that. So the way they're going to respond is a couple of ways. One is they're going to just restrict the amount of Medicaid patients they accept into their facilities. Two is that they're just going to boot out already existing Medicaid patients to open up those beds for private pay patients so that they can still make money. Or they're just going to shut down entirely because they can't function without that Medicaid funding. Any of those scenarios is just going to be devastating to the vulnerable patient population that requires skilled nursing facilities for care. Those are elderly patients and disabled patients. And what's going to happen to those patients? You can't just throw them out on the street. A lot of them are just going to have to go back home and live with their families, who are going to have to figure out how to make that work, how to provide the skilled nursing care that they were getting at a nursing facility at home. A lot of patients who are in the hospital, who are ready for discharge, who would normally go to a nursing home, they're just going to be sitting in the hospital till we figure out a way to get them home safely. And that's going to cause a lot of delays in care because it's going to cause backup in the hospital, and patients are going to be waiting in the emergency room, and emergency room waits are going to be longer and longer because the hospital just can't discharge patients because they have nowhere to go. So this is a direct result of the big beautiful bill that Donald Trump campaigned upon that was in Project 2025. And elections have consequences, and despite knowing all of this beforehand, a lot of people still voted for it. A lot of people who have elderly parents in nursing homes. So this is going to impact every single one of us. And I don't know what to tell you, but it's because of the big beautiful bill. So there you have it.
Because I remember working in those nursing homes, a lot of those people were on, heavy medications that they had to take every so many hours. They were on breathing machines. They had to have 24 hours, 7 days a week, around the clock care. They had to be, bathed, fed, and turned. Get ready to quit your jobs, buttercups, because when I was working at those nursing homes, the one particular race that I didn't see in there wiping butts and feeding people were white people. I'm sorry, it's the truth. Majority of those people that worked in those nursing homes taking care of your mothers and fathers were black and brown people. The only white people that really worked in nursing homes were always the directors or something like that. They were the ones at the top of the food chain, right? So now that you got to come and get your parents out of these nursing homes, I'm petrified of what's going to happen to these people, because you got to turn them every so many hours. You got to feed them every so many hours. They're on ventilators. They got to take medications at a certain time. I'm almost petrified of what's going to happen to these people. But you voted for this. And now you got to be the CNAs, the home CNAs for your parents. And I don't know about the rest of y'all, but have you ever picked up your mom or your dad that what now weighs, 235 pounds of dead weight? Baby, that ain't nothing to play with. And if you can't afford for them to be in these nursing homes, you damn sure are not going to be able to afford somebody to come in your home and take care of your parents. And you guys don't be united like that. You hardly ever see black people in nursing homes. Rarely you do. Sometimes you do. But majority of a nursing home is filled with older white people. I'm scared of what's going to happen to these older people in here. Them being at home, no one's, coming to see if they're okay or if they're getting their medications. Now it's just you and them. And you're not going to be able to afford the medications that your mom and your dad is on. This is going to be a big ass problem. But y'all ain't think about that when y'all asses out there voting, did you? Because you thought it was going to be everybody else, and now it's your ass.
People talking about make room for Mima and Pawpaw. They gonna have their asses living in the living room again. They gonna set up a cot bed right there in the living room again and have her there sitting there with all the kids all day, all night until that lady pass away. That's what it's gonna be. Elderly abuse is gonna skyrocket. Y'all think that they was being neglected and abused in them nursing homes because they were short staffed, which they were. But it's going to get worse in them family houses. People think, oh, nobody will love you like family. No, some of these families going to get revenge on these folks. It's parents and grandparents out here that did nothing but beat, berate, and drink and get high and do nothing but terrible things to their kids and grandkids. And you think if they forced to take them home, they're going to do right by them. Y'all will be mistaken. Y'all going to see a bunch of terrible shit in the news. A bunch of terrible shit. Just like how during COVID, child abuse and domestic violence went up, elderly abuse gonna skyrocket.
Now, in my case, like my dad, we actually pay out of pocket, or I should say he pays out of pocket for his nursing home care. But what is it going to do when I guarantee you like 70-80% of the people who are at my dad's facility are in some type of Medicare reimbursement, especially if they're in like very long-term care situations. Like that is super common. I don't think people understand that. And so what's going to happen when these facilities can't fill the apartments because there's not enough people who can afford? I mean, to give you an idea, it's over $4,000 a month, guys. $4,000. I mean, think about like that. That's like almost triple my mortgage. Okay. It's crazy. And in my case, like, what would happen if I was in this situation? Because I'm thinking about that. Like, what's going to happen if, like, my dad's facility, for example, shuts? Because there's not going to be beds anywhere for these people to go. So the burden is going to be on the families. And, like, in my case, I don't have anywhere to put this man. And I don't live in a handicap accessible home. And there is no housing in my area. So I can't just, like, pick up and move. And I have a mortgage from 2011. Like, I can't just move. Like that's not really an option. So like I don't know what I would be doing if I was in that same situation, and I am really worried. And if you're thinking, well, I'm so lucky, I don't have anyone in nursing care, I'm not going to be impacted. Let me just tell you that this is just the one little arm of the ripple effect that this is all going to have, right? What's going to happen when hospitals aren't getting reimbursed for things? What's going to happen when your doctors are not getting reimbursed? They're going to go private practice. I'm telling you, this whole healthcare system is like on a house of cards. Like it's all going to come crumbling down, and it's going to come crumbling down fast, unfortunately. So if you are worried about this, if you have loved ones that are going to be impacted, or you know you're going to be directly impacted by this, please know you're not in this alone. Please give me a follow, give me a comment, because I want to engage with people that are going through this same thing, because it is not easy and we need to come up with strategies together. And sometimes it's nice to just have somebody to vent to. So anyway, I'm here for you guys.
What he likes to call the big beautiful bill. That agenda sought to limit federal Medicaid funding and shift the financial burden to states. So now in 2025, we are living with the consequences. The COVID era protections that paused redeterminations are long gone. Medicaid unwinding has dropped over 20 million people. And with fewer residents covered and payments still too low, nursing homes are making hard financial choices. So some are shutting down entire wings. Others are refusing new Medicaid admissions. And yes, some are discharging long-term residents. So if you're asking why your father is being kicked out, the answer is because the system is being defunded on purpose. When you vote for politicians who promise to shrink entitlements, this is the real world result. Elderly people getting eviction notices. This isn't just bureaucracy, it's policy. And it's hurting families like yours right now.
Medicaid has long been the safety net for seniors who can't afford the massive cost of long-term care. But with the recent healthcare cuts, lower reimbursement rates, and increased operating costs, many nursing homes are saying they simply can't afford to keep up accepting Medicaid patients anymore. They claim the funding they get from the government doesn't even cover the cost of the basic care. That is food, medical attention, staffing, and facility upkeep. And so, one by one, these facilities are dropping out of the program. But here's the problem. When a nursing home ends its Medicaid contract, it's not just a financial decision, it's a human one. The residents who depend on Medicaid have to move out, often within weeks. Some are uprooted from communities they have known for years. Others have to move far away from family members who visit and help them. Imagine being 85 years old and suddenly you are being told that you have to leave your home because the place you live no longer accepts your insurance. The impact is even worse in rural areas. There may be only 1 or 2 nursing homes within hundreds of miles. If one closes its door to Medicaid, residents may have no realistic option left. Families are now facing heartbreaking choices, paying thousands of dollars a month out of pocket or moving their loved ones to a facility far away. And this did not happen overnight. Years of underfunding coupled with recent political decisions to cut healthcare budgets and prioritize other spending have created a situation where vulnerable Americans are once again paying the price. The One Big Beautiful Bill and other cost-cutting measures may have looked good on paper to some politicians, but the reality is that it's forcing seniors and people with disabilities into instability. What's more, this problem will only grow. America's population is aging and more people will need long-term care in the coming years. Yet, instead of strengthening Medicaid to handle that demand, we are watching the safety net unravel. Nursing homes and administrations are warning that if nothing changes, more facilities will walk away from Medicaid contracts, and more seniors will be left in limbo. This is about more than money. It's about the kind of society we want. Do we care about our elders when they can no longer work or care for themselves? Or are we willing to turn a blind eye and let them fend for themselves in their final years? Because right now, the system is failing them. And once again, it's the most vulnerable who are paying the high price. Let me know your thoughts in the comment section below. And thanks for watching. I'll see you in the next video.